Howdy ho. Well, this is weird. I'm on my new iPad and it's like I'm facing, I don't know. Anyway, if it's a little weird, sorry. You can kind of see up my nose. Thank God I don't have any boogers. Okay, so I got about a 5 minute break. God, it's been busy today, which is good. That's really good. Don't get me wrong. But I have about 5 minutes. I got to go to Albuquerque this week, and so I'm going to be busy. Like, I'm not going to have any time to be doing any dumb things while I'm there, which is probably good. So I don't always need to do something dumb when I go to Albuquerque. I'm getting a little bit of a reputation in Albuquerque, if you know what I mean. But listen, I wanted to do some just really quick. I wanted to talk about medical terminology. So once I went to nursing school, terms that I used every day before are now very different. And so I just, oh, my nose itches. And so I wanted to just give you a little overview of my world. And being as juvenile as I am, sometimes some of these words crack me up. Okay, probably not going to crack you up as much, but I just wanted to share because I've got 5 minutes. It's my 5 minute break. I was going to go pee, but no, I chose to spend my 5 minutes with you guys. Okay, so the first word is discharge. Swear to God, discharge. It's a great word. Okay, so in a normal sense, like normal people would probably say, "Oh, that dumbass discharged his firearm in the city limits and he got a ticket." It's pretty straightforward. In nursing, discharge is something totally different. If someone has discharge, it's typically coming out of somewhere out of their body. So, like vaginal discharge or nasal discharge. Like, there's all different kinds of discharge, okay? So, a sentence we might use for discharge would be, the lady in 2A just had vaginal discharge that smelled so bad, I can't go back in there. I can't do it. So yeah, discharge. It's just one of those words. Slough. Slough is a good one. So regular people would say, I was just talking about this the other day. We used to leave Midvale Junior High and we would slough and we would walk to the Arctic Circle. And then London said, well, what's slough? And then I had to really backtrack because he's going to junior high soon. So I said, it's just lunchtime. And sometimes you can go to other places, but you need to go back to school. It's not going to work, I'm sure, but I tried. So in the nursing world, we would say, the lady in 2A, her wound has got green, gooey slough. And slough is like, kind of like discharge. It's just something is coming out of there. It's like sloughing it off, okay? Another one is blowout. Blowout's a good one. Not if you're an aide or you have to clean it up, but a blowout would be like, okay, I'm driving down the freeway, had a blowout. That's pretty straightforward. But in nursing, oh boy. Oh boy. Okay. So 2A just had the biggest blowout I've ever seen. One of the aides was actually covered in it. Okay. Use your imagination. A blowout, just like if a baby has a blowout in their diaper. Same thing. Adults do the same thing, but trust me, it's more and it's messier. Okay? Abduct. This is a good one. So, a way I would use it before I was a nurse would be like, I don't walk down the street alone because I'm afraid someone will abduct me. And that's the honest to God truth. That is one of my big fears. Someone will abduct me. They probably would give me right back, but somebody would abduct me. So in nursing, that just means that they're moving something towards center. So like your arm, you're abducting your arm, so you're moving it towards the center of your body. Okay, a beaver. This is a good one. A beaver. So normal everyday term would be maybe like, wow, look at that beaver. It's got big teeth. That's how I'd probably use it in a sentence. But in nursing, actually, they use that in the OR. So it's a blade or a knife. So they'd say, give me a 16 beaver. And then you just give it to them. Okay. I'm not a surgical tech, but that is an honest term. CAT scan. lost my cat. I'm scanning the horizon for my cat. Dang thing ran away. And then, of course, we know CAT scan. We just tell patients you're going to go in a little tube, probably going to have almost a nervous breakdown. Just keep breathing. It'll be just fine. It'll end sooner or later. Foul. This is a good one. Foul. So normal term might be, she hit 4 foul balls. She should be out. But no, in nursing, foul is something completely different. So, we could use this. We could roll this into a couple things. We could say 2A had such foul vaginal discharge. I've never seen that color, and I've never smelled anything like that in my life. Please don't make me go back in that room. I can't do it. So there's a couple more, but that really is kind of the basics that I kind of put on my list. So just wanted to share. Alicia, you're going to be going to nursing school. Life is going to change for you too, because these words are going to take on a whole new meaning for you as well. So when I'm back next week, we'll try to put something a little bit better together for you. But I did want to spend my 5-minute break with you guys. I enjoy spending time with you, and I wanted to try out my new iPad to see if I could record on it. And the only thing that's weird is I'm looking like I'm trying to look straight on, but it makes me look like I'm looking the other way. I don't know. It's a little bit weird, but I don't have any boogers in my nose. Yeah, nothing in my nose. It's all good. So take care. I'll check in with you guys hopefully next Monday or Tuesday, and we'll get something rocking and rolling next week. Okay, bye-bye.